All right, today we are talking about decompression, okay? They estimate somewhere between 60 and 70 adult Americans that have some sort of disc protrusion or disc injury. Not all of them are symptomatic, but many of them are. So if you are one of those people that have a symptomatic disc, or you're worried about it and you want to treat that, today we're talking all the inexpensive or free ways that you can decompress, okay? Now here's the rundown. Rule number one, no pain. Because the disc, when you're treating it, whether you're leaning forward or back, depending on the direction that you're decompressing, you can irritate the disc, okay? So if you start to feel pain, stop, go find another one in a different direction, or you have to kind of modify, okay? So that's rule number one. Rule number two, I find that most patients respond better if after decompressing you also stabilize. So during all of these, we'll go from like decompression, I'll show you how to decompress it, and then we'll go next to the stabilization. So decompress, then stabilize, and then we also do stretching, but we're not doing a ton of stretching in this particular video. We're talking about just decompressing the disc. All right. Most of these you can repeat. Some of them you don't want to, but I usually say we want to mimic the patterns we see, like our decompression when we treat people here at the office. So that progression usually goes from 1 to maybe 10 to 12 progressions through there. Usually the pulls on decompression will usually decompress for about 40 seconds. I usually say go anywhere from 10 to 15 seconds of decompression to 10 pulses or just a quick stabilization at the end. So on decompression, we usually pull for 40 seconds, release for about 15, and then afterwards we'll want to have them do some sort of contraction of the core so that they're nice and stable, or we have a different machine here, okay? So that's kind of the rundown. We're gonna go through all the different ways, and hopefully this is helpful and you can find one that's gonna help you to decompress your disc.